Thank you so much for joining us. I hope everyone's having a wonderful day. This is Options for Children Who Learn Differently. Thank you so much, Nikki Kerrigan, for the title of this. That was very helpful. I really appreciate all your feedback. So I'm a behavior analyst. I have been a behavior analyst since 2021, but I've been working with children since 2003, and I've been a supervisor since 2005. So the bulk of my experience is working with kids and supervising people. So that makes me very good at coaching parents on how to work with their children. I started my own company, LFA Behavioral Consulting, and my values are transparency, compassion, partnership, and effectiveness in behavior analytic practice. And I started this because I feel like there's a real need for one-to-one coaching for people. I think a lot of people get ABA services and they don't get really good feedback from their ABA providers. Not all of them do. I mean, there's some good ABA companies out there, don't get me wrong. I actually work for one. I have two jobs. I have a job, and then I have this job. So I really felt like I could be way more flexible if I started my own company and started doing my own thing. So this is what we're going to be going over. Again, the overview here is a little bit out of order, but it'll be fine. So we're going to go over understanding special needs and eligibility, common diagnoses that qualify for support, how to determine eligibility, what kind of available support services people have, and therapy options, school-based versus private services. And then we're going to go over how to access services like evaluations, insurance, financial assistance. The financial assistance piece, I don't have a lot of financial assistance piece because that can get very, very particular to the individual case. So if you're interested in that, I can find out more for you based on your situation after the webinar and navigating the system. And we're going to talk about an introduction to what ABA and parent training is, how ABA can help and all that kind of stuff. Of course, I got to plug that because that's what I do. But most of this webinar is not about what I do. It's just about where I felt like the need was in the community. So seeking diagnosis and eligibility for services. Here's a short list of common diagnoses that usually qualify for support. So there's autism, ADHD, learning disabilities, genetic conditions, behavioral and emotional challenge, or sensory and motor challenges. Now, the genetic conditions, I would say, comprise about 30% of what we call autism. So a lot of times we'll say, oh, this kid is autistic, but most kids with autism never get genetic testing. And so what looks like and gets diagnosed as autism by various physicians and even schools will say, oh, that's definitely autism. About 30% of the time, it's a genetic condition, like a specific genetic condition. So if you can get genetic testing, I suggest that you do, although it does take a long time and sometimes it's expensive. There's various learning disabilities, and that, like dyslexia, would fall under that. Dysgraphia is another one. And behavioral and emotional challenges, those are wide ranging, as well as sensory and motor challenges. I had a supervisor who had sensory processing disorder, and she was very interesting. She got very particular about little things in her environment. So like one little thing was every time I had a drink with a straw, she's like, please put the straw away. I feel like it's going to poke me in the eye. It's just part of her sensory processing thing. She was a delight. I loved her a lot. So why seek a diagnosis? There are several reasons why, because a lot of parents will tell me, I don't really want him to get a diagnosis, or I'm worried about it because I feel like this is going to be a stigma, or this is going to be this is going to be like an issue. Like people are going to judge him based on the diagnosis. And that is true in some situations. You can see somebody get judged for a diagnosis. A lot of kids with autism don't get treated very nice, because, oh, you're autistic, but that's becoming more and more rare. I think there are many benefits to getting a diagnosis, and the main thing is getting access to services and support. So many therapies like ABA or speech or OT require a formal diagnosis for insurance or state funding. You can access educational accommodations based on a diagnosis, like schools require documentation for IEPs or 504 plans or specialized instruction. It can help you understand your child's needs better. A diagnosis can help parents and professionals create targeted support strategies. And you can get help with insurance, of course. Like, insurance isn't going to help pay for nothing unless you have a diagnosis to go with it. And that goes for like Medicaid waivers, disability benefits, private insurance, or even stuff like, in the future, like scholarships for college sometimes are specific to certain disabilities. So even there. And also it can provide a parent with peace of mind. If you or a loved one has a child who they're thinking may need special needs services, or maybe already has special needs services, having a diagnosis can kind of quiet the back and forth about what's going on. And then you have your answer, and then you can start moving forward with that information. I've even talked to parents who said, well, I don't really think that my child is autistic, or I don't really think that my child has a speech delay, but he's 4 and he's not really talking much. And I always say, go ahead and seek a diagnosis, because if the answer is no, then that is also an answer that will give you peace of mind. So there are 2 different kinds of diagnoses. There's medical diagnosis and educational diagnosis. Now, the term educational diagnosis is a bit of a misnomer because schools don't diagnose, but they do have psychologists, school psychologists, who can do assessments, and how your child rates on those assessments will point to a potential problem. School psychologists can also determine if your child, for instance, is having trouble in school due to a certain difficulty that's showing up in the classroom, and then they can get basically a school eligibility that's just for them at school, but it wouldn't count as a medical diagnosis. So part of the difference is medical diagnosis is given by doctors or psychologists or specialists based on clinical assessments and standardized criteria, like the DSM-5, tests for autism and ADHD. It's used to access medical services specifically, that's everywhere outside of school, such as therapy, medication, insurance-covered treatments. Examples are autism, ADHD, anxiety, and dyslexia. Often it requires referrals, evaluations, and sometimes it might require genetic testing, depending on what is suspected. Now, an educational diagnosis is conducted by schools through a special education evaluation, right? That is the evaluation that you're getting because you want a special education plan, or an IEP, individualized education plan. It's based on whether a condition impacts learning. Educational diagnosis can provide accommodations for your child in school and special education services, right? But this has to do with school. It won't help you anywhere else, just at school, if you go through the school to get this, right? If you get it through your physician, you can take that to the school and say, based on this, I need an IEP. Schools don't diagnose medical conditions. I just want to make that really clear. They do assess educational needs. So, key differences and considerations between the two. Again, schools don't provide medical diagnosis. A child can qualify for special education services, but not qualify for a medical diagnosis, right? So for instance, a child with dyslexia that is impairing their learning ability in school, they could end up with an IEP, but they never get diagnosed medically. Again, a child could also have a medical diagnosis, but never qualify for an IEP. So for instance, some like blind and hard of hearing situations, a child will have a medical diagnosis, but they're doing so well in their education, they only require a 504 plan, to help them out, but they don't require an IEP. Having both allows for the most comprehensive support. So what are the steps on obtaining a diagnosis? Number one, you have to consult your pediatrician. That's the first person to go to. Usually you're going to go to your pediatrician and you're going to request a comprehensive evaluation. You say, I would like my child to be evaluated. And we'll talk a little bit more about tips as far as talking to professionals like physicians, how to make sure that they hear you. You may end up seeking a specialist after the physician. So the physician may say, okay, I'd like you to see this. I'd like you to see a geneticist and get genetic testing or this or that. So they're going to point you to where you need to go. So neuropsychologists, developmental pediatricians, child psychologists, usually you get sent to a child psychologist. Psychiatrists can diagnose conditions. Anyway, so that second professional is going to do the actual diagnosing part. Step 3, you're going to take that evaluation or that diagnosis and you're going to take it to the school. And then you're going to say, I need a school-based evaluation. I need an evaluation for individualized education services, or I need an evaluation for special education services. That's the same thing. And then with that, you're going to have some sort of assessment happen. There's public and private assessments. Like private evaluations are much faster. Like for instance, let me roll back a little bit. Go back to seeking a specialist. Let's say your physician says, okay, I'm going to refer you to a child psychologist. You're going through Medi-Cal. They give you the name of a child psychologist or maybe a list of several. You call them all, and all of the waiting lists are 6 months long. This is really common. You could Google child psychologist near me and find a private one and pay out of pocket, probably a pretty penny, but get through much faster. Or you could just do the waiting for the Medi-Cal child psychologist, right? So this is why I have the note about private versus public assessments. The same with genetic testing. If you feel like your child really needs genetic testing, and you're going to go through like Medi-Cal, the wait is going to take a very long time. If you try to seek it privately, it might go a lot faster, but then again, you're paying for that. Step 5, once your child is diagnosed, you can start to explore therapy options and support services. Where you can explore for those therapy options is going to be based on the assessments that you were handed. And that last page where it says recommendations, that's the stuff that you can go seek. We'll talk about important stuff about documentation in a second here. Okay, so there's some important tips when it comes to this entire process. Even if you have already been a part of this process and your child is already receiving services, you can start now with these tips and you'll have a much better experience with working with these services. Our first important tip is start ASAP, right? So diagnosis is a long process. Even the process of like receiving and working through your child's services is a process. Long waiting lists are common. There are a lot of kids out there who have special needs. Earlier intervention usually means faster progress. So that's why I say start ASAP. Even if your child is much older at this time, you still want to start as soon as possible. Like start today if you can. If there's one tiny thing that you can do to move your child forward in this process today, I would start now. Important tip number 2, keep all documents. I suggest that you get a notebook, and every time you talk to any professional, you write down the date and you write down what you talked about. That's the least that you can do as far as like your basic day-to-day documentation. But anything that you're given, either physically printed out like list of recommendations, an assessment, any kind of report, any kind of evaluation, any kind of like, if somebody calls it a progress report, anything at all that you get from these professionals, you want to keep it. Try to come up with some kind of way to organize. If your way of organizing is physically printing everything out and keeping it in the same folder, that's a great place to start. Start there now. If you're already in the position where many parents, when I talk to them, they're in this position, they're like, well, I kind of can't remember where it is. I think it may be in that file. I know I've got another one on my desk. And yesterday I found another piece of paper in this pile. And, I would say at this point, your first step in your process is going to be making sure that all your documents are gathered and you know where they are. If you have not been given a digital copy of one of these assessments, I say that you request them. Another thing you need to make sure to do with this documentation tip is you need to make sure that you save the names and phone numbers or the names and email addresses of every professional that you've ever worked with. Keep them at the first page of that notebook. That's where you write all of those. Next page of the notebook starts your dates. In the back of the notebook, you stuff all of your paperwork, right? That is a system. You just need some kind of system. Keep them organized if possible. And if you have trouble organizing, I can help you with that too. All right, so important tip number 3, you want to speak up. Be the squeaky wheel. Parents have the hardest time with this piece. This is the one thing that this is the most important tip, number 3. You want to speak up. You want to be the squeaky wheel. If you feel uncomfortable, if you feel like your concerns have not been met, if you're not sure what to do, call, ask, advocate. State your needs in strong terms and don't give up. We're going to come back to these 3 tips in a few minutes after we go over some more slides. So what services are available out there? So many, really. So there's the Inland Regional Center. I hope some of you are familiar with the Inland Regional Center. They can be very, very helpful early in this process, early in a child's lifespan, and then as they're entering adulthood. Those are the 2 times when the Inland Regional Center seems to really step up and provide lots of services. So Inland Regional Center can help families, let's say, before they've even gotten a diagnosis and you suspect that your child may have special needs. This is when you reach out to Inland Regional Center and you tell them these things. And they should be able to get you interim services while you're waiting for a diagnosis. Makes them super, super helpful. Also, when a child is entering adulthood, they have a lot of good transitional services. And after insurance services cease when they enter into an adulthood, if you're already an IRC client, they can help you there. So the Inland Regional Center is a state-funded agency that provides services for individuals with developmental disabilities. Its mission is to enhance independence and improve quality of life for children and adults. People who qualify are individuals who have a developmental disability, which includes conditions like autism, intellectual disability, cerebral palsy, epilepsy, or related disorders. And the disability had an onset before age 18. So if they became disabled or acquired epilepsy at age 20, they're not going to be eligible for Inland Regional Center services. If it was before then they are. So services and programs offered by the Inland Regional Center are early intervention, as I was saying, for children between 0 and 3. Behavioral therapy programs. They have respite care, also known as IHSS. Let's see. Through IHSS, if you haven't heard about it, if you get approved for IHSS, you could be paid to take care of your own children if they have special needs. Independent living skills training, helping them learn daily living skills like cooking, budgeting, and personal care. They have employment support programs like job coaching, vocational training, assistance with job placement, preparation for individuals to enter the workforce. They have assistive technology services and transportation services. Now, this is just a tiny slice of what IRC offers. They actually offer a lot, but it can be very hard. I'm just going to give you a warning. It can be very hard to access their services because everybody who works at Inland Regional Center seems to be extremely busy. So you might call a bunch of times and have a hard time getting services. And you want to just be that squeaky wheel and speak up as much as possible. Get people's numbers, write down their names, do the whole thing. Get somebody else to call them for you. Like, hey, you know, like you get someone like me to call on your behalf, and then have two people calling. That's the way to do it. So how do you apply for Inland Regional Services? And interested families can submit an intake request online or call the IRC for assistance. You can go to inlandrc.org because this is for this area, the Inland Empire of Southern California. You'll need to provide medical and educational records, so be prepared for that. And if you're eligible, the families will work with someone called a service coordinator to create an individual program plan tailored to their child's needs. There are school-based services like IEPs, that's individual education programs. An IEP is a legally binding document under the Individuals with Disabilities Education Act. I almost made a slide on IDEA, but it is so big. I was like, my webinar is going to go on forever. I might need a webinar just for the Individuals with Disabilities Education Act. So an IEP provides special education services and accommodations for students with disabilities. They are tailored to a child's unique learning needs, and they ensure a free and appropriate public education, or FAPE, F-A-P-E. Free and appropriate public education is really an important term. It is a, hey, everybody, listen, I'm talking legalese and you better listen up, right? When you're talking to a school. Free and appropriate public education. So that means every student is no matter what their condition is entitled to a free public education. And an IEP ensures that your child gets that. So people who qualify for an IEP are students who have disability that significantly impacts their learning and academic performance. Many of these are the diagnoses I mentioned in the other slide. It requires an evaluation by the district special education team, and you have to ask for that. So an IEP includes present level performance. That means they're going to test your child to make sure that they fully understand their strengths and their weaknesses and their current academic abilities. It includes measurable goals. So here's where your child is, here's where we want them to be. It includes special education services that might be speech therapy, it might be OT, it might be behavioral supports, it might be a one-on-one, it might be adjusted curriculum. It requires sometimes stuff like extra time on tests. The push in an IEP is that your child is in the least restrictive environment. So they don't want your child to be like sequestered away from their typical peers. They want your child educated alongside their peers as much as possible. And an IEP process has a lot to do with parental rights. Parents can request an evaluation if they suspect their child needs support. Don't let a school district tell you that your child isn't going to qualify. They need to do an evaluation to determine that. And the school must complete an evaluation within 60 days of the request. An IEP team that includes parents, teachers, and specialists meets to review and set these goals. And then this is reviewed annually and updated for reevaluation every 3 years. Yes, and you have to request it in writing. Thank you so much. Excellent. Key takeaways. IEPs provide individualized support. Parents play a critical role in IEPs. If the parent isn't involved in the IEP process, sometimes it works fine, but a lot of times it doesn't. And not all struggling students are going to qualify for an IEP. What is a 504 plan? It's like IEP light. It's like IEP without the teeth. is a legal plan under Section 504 of the Rehabilitation Act, designed to prevent discrimination against students with disabilities. It ensures students receive accommodations so they can fully participate in a general education. But unlike an IEP, it does not provide specialized instruction. So there's no curriculum changes associated with a 504 plan. It focuses on accessibility and support. So for instance, a child who is blind or hard of hearing might receive accommodations via a 504 to help them access the curriculum, but there's no changes to the curriculum or the class structure that are individualized to them. So kids who qualify for 504 plans are a student with a physical or mental impairment that substantially limits a major life activity like learning, attention, mobility. Common qualifying conditions for 504 plans include ADHD, anxiety, dyslexia, and medical conditions like asthma or diabetes. Children who need medication or special services within their school day to help them manage their medical condition. Key accommodations under a 504 plan are classroom supports, assistive technology, medical accommodations like permission to take medications, dietary modification, extra bathroom breaks, and behavioral supports. A 504 plan process includes parents, teachers, and school staff. Any one of them can request an evaluation for a 504. But unlike an IEP, 504 plans do not require a formal reevaluation every 3 years, right? So once the 504 plan is in place, it kind of coasts. It should be reviewed periodically, but it won't be unless somebody speaks up. 504 plans provide equal access, but they do not modify curriculum. It's easier to qualify for a 504 plan than an IEP, right? But again, a 504 plan doesn't have the same teeth as an IEP. It's not enforceable in the same legal way and doesn't have the same structure behind it that supports an IEP. So a lot of times I would counsel families not to go for a 504 plan, just because the only thing that's going to make a 504 plan move forward is lots of parental involvement. The only one who's going to make sure that it's running smoothly and it's being remaining in place the way that it was designed is the parent checking in. So takeaways: it provides equal access, doesn't modify curriculum, it's easier to qualify for, but parental involvement is key for ensuring accommodations. So what if your child is not? Oh, thank you. 504 plan can help with college supports. That's awesome. So what if your child is not in public school? Do you get an IEP? No, but you get something that's comparable to an IEP in its own way, although again, doesn't have the same teeth as an IEP, right? Doesn't always have the same supports as an IEP. It's called an individualized services plan. So if you've chosen a private or parochial school for your child with special needs here in California, like homeschooling or all other alternative setups, you as a parent, or let's say you're enrolled in a religious school. Let's see, my notes are a little weird here, so I'm gonna have to pause and read them over. Okay, California follows a federal law with a twist under something called child find. The child find process outlined in the California Educational Code. Please excuse me for my pausing. Okay. So under the California Educational Code, every local education agency or area, that's called an LEA, they're required to find or locate every kiddo in their area, regardless if they're in public school or not. They're supposed to find them and get them services. So that means if your child is homeschooled, they can qualify for special services. And you can get those special services through your local education area. There's a catch in California. The LEA can't make the private school try interventions before there's a referral. So that's for you to work out with the school. If your child qualifies for special services, they won't get an IEP. They're going to get an ISP instead. And it's for equitable services, right? So that means basically that your local school district, which even if you're homeschooled, your local school district is the one that's delivering these services. And they're going to do the best they can with what is available in your area. So you might not get the speech and the OT and all the things and the services that are available in a public school, but they're going to give you they're supposed to give you something that's comparable, right? It might be that they pay for someone to consult with you, right? And give you a little help out, but it's not quite going to be the same as an IEP. Most parents who homeschool their kids or have their kids in a parochial school don't even know that they can even qualify for stuff. So we're going to talk about where you can go for more information. I did put up on the screen the link to IDEA. And by the way, in addition to getting a recording of this after the fact, you're also going to be able to get these slides. So I'll send you the slides so you'll have the links to click on. Let's see. Check my notes for anything. I have them all in paragraph form instead of bullet points, and that was not a smart idea. All right, next slide. Oh, you're welcome. So what does it look like for you as California parents? Let's break it down. The ISP, or Individualized Services Plan, is what the LEA, through your SELPA, so many of these, SELPA, what does SELPA mean? I'll tell you in a second. Your SELPA puts together the outline of what they'll provide. It might cover things like speech therapy or some consultation for your child's private school teachers, but it's not the full package you're going to see in an IEP. It's like a smaller slice of the pie. California law ensures equitable access, but it's limited by what your SELPA can fund and prioritize. The big thing to know is that California's special education system is split into over 130 SELPAs. Those are areas, and each one interprets federal rules a little differently. For example, in LA County, you might get more direct services, while in a rural SELPA, you could get mostly consultation. So you have to check with your SELPA. Every region has its own plan, but if you look up, Google my local SELPA, you should be able to get something. SELPA, SELPA. You can also call the California Department of Education or look at their website to find where your local area plan is. Special Education Local Plan Area. Thank you. Aha. So here's the number for the Riverside County SELPA. Sorry if you're not in Riverside County, but look it up. I'm sure you'll be able to find it. It's at rcselpa.org, and the number is there on the screen. Riverside County SELPA is the biggest one of all of them, unfortunately. It's got 25 local areas. It coordinates services for private school students, and there's a lot of variations between them, right? So if you look up one SELPA or maybe you've moved areas, you might not get the same services from SELPA to SELPA. Let's see. So this SELPA covers Riverside Unified, Corona Norco, Moreno Valley, and a lot more. Let me see if I have anything else. If you need help looking up your SELPA, let me know at the Q&A at the end. So what kind of therapy services are available through all of these beautiful supports? We have occupational therapy. This focuses on fine motor skills like writing or buttoning clothes or sensory processing, daily living skills. Benefits for children. There's benefits here for children with sensory sensitivities, like can't handle loud noises or certain touches, or for instance, children who have difficulty with independent tasks, like your child is 5 and still can't handle a zipper. This is definitely an OT thing. Physical therapy helps with gross motor skills, and those are like balance and strength and coordination and overall movement. They're often used for children with low muscle tone or delayed motor milestones or physical disabilities affecting their movement. Speech therapy addresses speech clarity, language development, social communication. Some speech therapists actually also specialize in like swallowing difficulties and eating difficulties because they're dealing with the musculature of the mouth. They can also assess feeding and swallowing difficulties as well. They can help children who struggle with articulation, understanding language, children who have a hard time using communication effectively. And then we have, of course, my specialty, applied behavior analysis, which uses behavioral science to teach new skills, reduce challenging behaviors. This is often used for autism, but there's no barrier for ABA. Maybe an insurance company might say ABA is only for autism, right? But ABA can be used with anybody. It's because it's the behavior science that's the thing. And it doesn't matter if a child has a diagnosis or doesn't, or what their diagnosis is. Key takeaways here are each therapy targets different areas of development, and some children may benefit from multiple therapies at once. You usually need a diagnostic assessment that indicates that your child needs these services in order to get them. So you have a diagnosis, you got the assessment, the piece of paper at the back that says recommendations. It should list therapies like this on those recommendations, and those are the ones that you can ask for. So other supports include medical and mental health supports like counseling, psychiatry, medication management. Oh, how do you get ABA? You have to have it on some sort of, usually, if you're going through insurance, you have to have it on some sort of recommendations list. So your child has been evaluated by a child psychologist. The child psychologist has on the recommendations page at the back of that assessment, it lists applied behavior analysis services or applied behavior analysis therapies. And then you can contact your insurance company and say, hey, this is what the child psychologist said, give me a list. Another thing that you can do if you're going through insurance is you can just Google ABA therapy near me, and then the company that you contact, they want your services, right? So even if you didn't go through insurance initially, they can look up your insurance company and see if you qualify, if they cover that, if they work with your insurance company. And they're happy to do that. So yeah, you're welcome. So it's actually quite easy usually. And you also want to look up reviews. A lot of ABA companies have wait lists, so just be aware of that. And I'll talk more about ABA in a few minutes. So along with medical and mental health, we also have the services of social workers fall under this, which can help families navigate access to community resources. Community resources might include parent training programs, respite care, support groups, and advocacy organizations, especially if you're having trouble with IEPs. Assistive technology might be part of this, like communication devices, speech-to-text software, or life skills and transition support. Like, for instance, if your child is aging out of services, then vocational training, job coaching, and those are mostly through IRC and similar organizations. Usually, if you've got the money, you can usually find an organization somewhere that you can pay to do these things. I know a lot of people like, oh, yes. I'm just thankful our insurance covers all ABA therapies, but anything extra like related services the boys will need is out of pocket. Yeah, that's true. Wait a second. I pressed the wrong button. Let me try that again. Okay. So, do you remember our important tip? I said I would come back to them. What is the first important tip? I'm using ABA on you right now, by the way. So let's see. Our first important tip is start ASAP. Whatever little thing. Ooh. There are some programs available through college grad students. Yeah. Thank you so much, Nicole Kerrigan. That's great. Yeah, I can help you with that kind of stuff. If you have any questions, after this, I'm going to stop the recording and you can ask me whatever you want. It doesn't even have to be on the slides. So first tip is start ASAP. Oops, press the wrong button again. Let's try that. Boom. Second one begins with a K. 3 words. Starts with K. Ready? It's keep all documents. And the next one is, this one deserves an exclamation point because it's the most important one. It is speak up. So start ASAP, keep all documents, and speak up. Number 1, what is it?
Start ASAP.
Start. Yes! Start ASAP. The next one is?
Keep all documents.
Keep all documents. You're amazing. And?
Speak up and advocate.
Speak up. Yay! That's right. Very good. You memorized all of the important tips. Awesome. You'll be thinking about that, tomorrow. You'll be like, oh yeah, the 3 tips. That's right. It was SKS. It's like, remember, it's like calling a kitty. Those are the 3 tips. How to access services. So you're going to have to identify your concerns first, right? So steps to getting an evaluation in the first place. Identify your concerns. You should be able to observe developmental or behavioral issues happening in your daily life. You're going to discuss these concerns with teachers and healthcare providers or anybody in their life, and you're going to write them down. And if you are seeking services like an IEP, if you're seeking a particular diagnosis, you're going to use the word disability. Okay, I know a lot of people don't like that word. You should use it though, right? Because you're trying to access something for your kids. Use the word disability if you think your child is going to need special education, especially. Gather documentation. Collect relevant medical records, educational records, developmental records. This might be proof of work in school that shows that they're having trouble. You want to prepare a list of your concerns, and you want to contact the appropriate agency. If your child is between the age of 0 and 3, it's probably going to be a regional center. If not, it's going to be your insurance. If you don't have insurance, you're going to probably seek a private doctor to try to get a diagnosis at that point. You're going to complete an application. So let's say you went to your physician. Your physician said, yeah, I'm going to send you to a child psychologist for a full evaluation. You're like, great. You get to the psychologist, and the psychologist sends you all this stuff. It's going to be forms to fill out. It's going to feel like you're answering the same question over and over and over. It's going to be like a form that says it takes 15 minutes, but it really takes an hour. And then there's another one after that. And then after that, you're going to have to go to a meeting where somebody like has your kid in a room for 2 hours and asks them to do all kinds of things. And then there's a tantrum. Just brace yourself. Brace yourself. It's worth it. You can do it. So the evaluation process is also probably going to include some standardized tests for your child. It might feel like, again, like you're going through the same thing over and over and over again, right? Just bear with it. I've done these tests, not assessment type of, not like diagnosis type evaluations because I don't diagnose, but I have done evaluations with parents. There's one I have to give my parents, the parents I work with, every 6 months. And they always look at me like, again? And I'm like, I'm sorry, it's again. I know it takes forever, but it's okay. You're going to have to review the results after you get that assessment. It's going to be a big chunk of paper or an email that's really long. You're going to read over that entire thing, even if it doesn't make sense. If you need help with reading one over and understanding what's in it, you can reach out to me. And you're going to discuss eligibilities for services. Make sure that you talk to the person who did the evaluation and so that you understand the services that they're recommending. And then you're going to approach providers. You're going to take that to your insurance company. You might Google for different services near you, and you're going to probably end up sharing that assessment with these companies that you're contacting. They're going to look it over and say, okay, yeah. And then you're going to communicate with service providers to understand their billing practices and insurance requirements. Important points to communicate. You need to make sure, okay, everybody's got that experience of going to some sort of like medical provider or some sort of services gatekeeper, like the lady at the front office, or maybe even the child's teacher, or maybe a principal, or maybe it's your own physician for you, and you just feel like they're not hearing you. You feel like you're making requests and nothing's happening. Here are some tips on how to be heard by providers. Number one, you want to provide clear examples of the behaviors or issues you've observed. You should be able to write these down, and they should sound like bullet points. You need to emphasize the impact. So explain how these challenges are affecting your child's daily life and their development. Like, what can they not do? What normal things can they not access because of these, whatever it is that you're seeing? You want to share information from multiple sources. So like earlier, how I said, you'd like start talking to everybody in your child's life and writing down your concerns. You want to share those concerns that you've written down, stuff from their teachers or therapists or other caregivers, stuff from other people in your family, stuff from, their teacher or, the coach of their soccer team. The things that you've seen, you want to write those down. You want to have those perspectives, because what you're saying is you're gathering evidence, like this person and this person and this person and this person also see the same thing that I'm seeing. And you want to use goal-oriented language. So discuss what outcomes you hope to achieve through the services. For example, I want my child to be able to socialize with his peers. He's not able to do that. Effective communication increases the likelihood of being taken seriously and obtaining necessary support. And you can take this advice to anytime you're talking to a services gatekeeper, like a physician. Key phrases that you want to emphasize for medical necessity. I suggest you screenshot this slide right here and practice using phrases like this. When you're speaking with a physician or an assessor, you want to use phrases like, I've noticed that my child struggles with, name a specific behavior or skill, which makes it hard for them to perform some sort of daily activity or something that is normal for most kids but doesn't seem normal for yours, or prevents them from accessing something like, going to the store, using the bathroom, learning effectively in school, being able to socialize with peers, being able to speak clearly, all those things. You want to, also get the name of the office manager in your pediatrician's office. They are a huge help in getting referrals moved up for you. Oh, that's beautiful. That's a beautiful piece of advice. Thank you so much. Awesome. So you also want to name exactly what you want to get, right? Because sometimes physicians, you kind of expect that like a physician or an assessor or an evaluator is going to know what is good for your child. They might not. So if you have an idea, even if you don't have an idea, if you're just think, I think this is the right thing, ask for it. You say, I feel my child would greatly benefit from occupational therapy or speech therapy or an IEP, right? If you're seeking special education services, make sure you use that word disability. And again, evaluate evaluate your communication. So if you're nervous, try speaking into your phone, do a little selfie video, talk to your phone, watch yourself talk, practice what you want to say, because every time you hear it and see it come out of your mouth, you're going to get a little more comfortable saying it. And then play it back and ask yourself, am I using specific examples? Is the impact of these skill deficits on my child clear? Am I demonstrating in my examples? Do they demonstrate a pattern? Did I state what my goals are? And am I open to collaborate? And the reason why I have this last one is sometimes it can be easy when you're a flustered parent to talk to an evaluator and be like, I'm so frustrated, and I'm not going to let you stop me from getting services for my kid or something. So it's easy when you're flustered to get a little adversarial in your tone. You want to make sure that your tone is open to collaborate and that you're being very friendly to the person you're talking to, even if they're telling you things you don't want to hear. If they're saying, well, I don't think so, and I disagree, you still want to have that tone of collaboration, because that's going to really help them continue to be on your side, because they're still a gatekeeper. So I have a section called funding services for your child. Because we're running to the end of our time for the slides, I'm going to rush through this, but if you'd like me to do another presentation on it, or if you'd like to talk to me privately about it, just let me know and I'll make the time for you. So funding can come from private insurance, Medi-Cal or IEHP, Inland Regional Center, or you can pay out of pocket for these services. The insurance route is, let's see, this one's very small for me right here. I love searching for providers near me using Google. I get really good results from that. Sometimes when people go through their insurance providers, they get these lists, and every single one of those providers that are listed on the whatever document they give you, every single one of them is full and busy and has a super long wait list. But when you research near me, you find people who, for some reason, weren't on the list, but they have openings. So try that if you're having trouble getting resources. You might run into funding issues. Insurance may deny if the concern is mostly educational, or if your child is not in public school. I've experienced this with some of my clients. Medi-Cal and IEHP may have limited home coverage, but I have to say, as far as getting ABA services, having Medi-Cal or IEHP is the best. That's not so, it's not true for dental, and that's a whole nother conversation. But for ABA in particular, IEHP does a really good job, and Medi-Cal is pretty good. Private or homeschool, you're going to end up doing more out-of-pocket stuff because you don't have an IEP. So ABA is my specialty. We're going to jump through this real fast. ABA is about the science of behavior. We teach skills, communication, and daily living. It can be performed at home or at school or in a clinic. My work, like I was saying earlier, I work for a very small ABA company, and I also launched LFA.org. Some people say that ABA can be robotic, or it's too focused on punishment, or it's rigid, or it's only for autism, and none of these things are true. The benefits of ABA is that it boosts your child's skills. It teaches them social skills, verbal skills, independence. It's tailored to your child. It reduces challenges like tantrums, like difficulty with daily routines, uses positive strategies. If you're receiving ABA, it should be very flexible. It's about the setting. And if you don't like your ABA company, get another one. It can be done. And parent coaching is something that a lot of people don't get in ABA, but should. So if you have questions, I'm the one to ask here. My services are all private pay services. I don't currently work with insurance. I do parent coaching or parent guidance. So that means the parent that I'm working with is the leader of what we're doing. And we work on one pain point at a time. Typically, my services, typically people see me once a week for parent guidance or coaching. And I'm there for maybe an hour, maybe two. I might call later in the week to check up on things and see how homework's going. But basically, it's a once a week service. I help with one single pain point where, let's say there's a piece of your daily routine that's not working very right. You know, it's child won't get going in the morning, you know, putting on clothes, getting the backpack, eating breakfast. Or let's say your child tantrums at a reliable time each day, or let's say your child won't give up his iPad, or let's say I had one parent that I worked with whose child would rock back and forth and flap hands at the dinner table so much that this child wasn't eating or interacting with the family. And so we can work on stuff like that, figuring out, okay, how can we make this better for both the child and you? And we work on that one little piece. I teach the parent whatever skills are relevant to that situation. And we reduce one pain point. And then after that is worked through, then if the parent wants, we move on to another thing using the same or similar skills. So the parent gets to grow in the skills that they're learning in a stepwise manner. I also do IEP advocacy. I've been attending IEPs since 2005. But mostly in my ABA career, I insist on attending IEPs when parents are open to that. I love collaborating. I love helping parents understand what's going on in an IEP. But it is important to note that my IEP advocacy work is not covered by my my behavioral credential. So as a BCBA, a board certified behavior analyst, I do the parent support. As a IEP advocate, that's not part of my credential. I also do study groups for the BCBA exam. So if you know anybody studying to become a BCBA, anybody who's getting ready to sit for the exam and they just need somebody real to talk to and learn from, they can join one of my study groups. These are free. I also am open to doing consultation for professionals and workshops and presentations like this one. And anybody who needs it can get an hour free with me. So if you need someone to talk to and ask advice or whatever, just hit me up. So you can scan this QR code. It's going to take you to ellafay.org. That's ELLAFAY.org. You can schedule that free 60-minute consultation. You can also find me on X, on LinkedIn, on Facebook, and YouTube. This link is actually going to go on YouTube too, but you'll only be able to access it if I share the link with you. I am planning to do more webinars. So I'll have, I think the next one I'm going to do is either going to be on IEP specifically or on a common condition called encapricis and how to help a child with that if your child is experiencing it. So in the webinar that I just recorded, we spent 30 minutes doing Q&A. And this I feel like is the best part because I get to meet my attendees where they are. If you need anything, go to ellafay.org and schedule an appointment with me. Thank you.